Hi, I'm Dr. Anitha, Senior Consultant Laparoscopic Robotic Surgeon from Yashoda High Tech Hospital. Today, February 13th, is celebrated as a World's Anemia Day. Anemia means one of the common prevalent condition in entire India, especially in our women and children. Why women and children are more prone for anemia? Every woman or a girl who enter a reproductive life start having periods or a menstrual cycle. Most of the time, during this point of time, she loses blood every month. But fortunate or unfortunate it is that our nutrition care for our adolescents are not given appropriately, due to which the loss is not being replenished. So most of our girls, young adolescent girls and children, because of nutrition deficiency or excess of heavy bleeding during periods, they become anemic. And in the same process it continues, wherein they become adolescent, they go into reproductive age and they become mothers, expecting mothers, and deliver. Even during this period of time, they never get their anemia corrected. Globally, this is a very highly prevalent conditions, almost around 28 to 30%. Comparatively to our male counterpart, women have high prevalence of anemia or a very low hemoglobin in the blood. The reason may be many. The commonest actually is nutrition. Second, menstrual blood loss. Third, deworming, which we don't do most of the time. Fourth, we don't replace these losses during the delivery or postpartum period. Our main focus will go through other aspects. And fifth is that no woman till date come up and tell her symptoms until unless she has become very severe anemic. The reason is very simple. The attention and nutrition support given to our mothers in our society is not much focused. Hence, our government of India, Telangana government are really focusing on providing good nutritional support to our adolescents and girls, expecting mothers, and following them to give iron calcium supplementation during the pregnancy, and also giving a lot of educational nutritional care to our women and adolescent groups. Today, all of us, let us join hands and come together and pledge to help each others. Most of the time, how do they present? They commonly come with, they don't come with any symptoms at all. The reason is that by the time they come with the symptoms, most of the time they would have dropped the hemoglobin to less than 8 grams, where they usually come with severe generalized weakness. This will be the only symptoms. On detail inquiring as a doctor during the clinic, they will slowly start coming up with symptoms of heavy bleeding or heavy blood loss during the delivery, or not replacing their hemoglobins, etc., etc., etc. Normally, most of our women adults will have a hemoglobin of 11 to 11.5. It's a minimum hemoglobin level. But on a majority of the women have hemoglobin between 9 to 10, 10.5 itself. That itself alerts us that the moment our hemoglobin drops, we become so weak, our general performance, our strength will come down. No good hemoglobin in the body will in general affect the entire system. Our work pressure, our performance will drastically come down. Every one of us need an adequate hemoglobin to sustain a routine activity itself. So most of the time you need to identify these symptoms and come to the attention of the doctor immediately. For a women and adolescent group, the simple thing, if any woman is suffering with excess of bleeding during periods, please don't neglect. Come to the attention of your gynecologist immediately. Second, if any child is not eating well, going to school, always weak, lethargic, looking pale, please bring her to the hospital to the attention of the doctor immediately. Any woman who is having multiple fibroids or an abnormal uterine bleeding or suffering with excess of bleeding, she is losing the blood. Don't wait stating that this will dissolve and years together you lose the blood and finally land up in a blood transfusion or in our iron supplementations. Fifth, our young children and school going children are more prone for worm infestations. Every year you have to come for a follow-up and get a deworming done. Let us all pledge together today, help our young girls and women about the nutritional care, menstrual hygiene care, and care of their health related to the cause of anemia and treatment of anemia, and to bring to our notice together, help all our women to have a healthy life, so that our women are healthy, our society is healthy. Let us stop this anemia, which is very high prevalent in our society, and make our women more stronger, our girls more stronger before they enter their reproductive life. Thank you so much.